Hi coders. So this is chapter 23 in your book. This is what we call E&M. And you really have to understand this because you are going to use E&M codes no matter what specialty, what facility, wherever. You have got to understand E&M codes. Okay? So this is really important information. Okay, so I'm going to do my best to take you through it. If you struggle, put something on the discussion board, email me if we need to do a Teams call, whatever. But you have to be able to get this information. I just don't know any way to say it. Okay. All right. So E&M stands for Evaluation and Management. Okay, and even though they start with 9. So remember, CPT codes are 5 digits, five numbers. CPT codes start with the number 9. But because every single specialty uses them, they're in the front of the book. Okay? So E&M codes are what are used for the physician to get reimbursed for his or her time to review test results, review medical records, see the patient, do the exam, come up with a diagnosis and a plan to treat the patient. Okay, that's what E&M codes are paying for. Okay, we're going to have preventative codes. We're going to have all kinds of things in this chapter. Okay? So, let's go through this. All right? So, first thing we need to go through, the first thing that you need to know is where the services were provided. Were they provided in the physician's office? Were they provided in the hospital, a nursing home, etc.? Okay, so I want you to stop your recording right now, and I want you to go to the table of contents in your CPT book on page X. Okay. And I want you to we're going to look at just the table of contents. So stop here and turn to that page. Okay, so if you'll see on page X where it says contents, you've got introduction, illustrations, E&M guidelines, and then you'll see where it says evaluation and management that starts on page 18. You'll see there's office or other outpatient services. You'll see hospital observation, hospital inpatient, consultations, emergency department, critical care, that whole list. Okay, that's why we say the first thing that you have to know is where the service was provided. Okay, so then the next thing that we have to determine so there's examples that's in your CPT book. Okay. Then the next thing we have to determine is the relationship between the provider and the patient. Meaning, is this a new patient or is it an established patient? Some places it doesn't matter. Like the emergency room, it doesn't matter whether they're new or established. Okay. But if you are doing coding office visits or outpatient services, you have to know if the patient is a new patient or established. Okay, so new patient means one who has not received any professional services from the physician within the past 3 years. But notice this caveat: it's not only this specific physician, but anybody else in that practice that is the exact same specialty. So let me give you an example. Let's say that I go to Graves Gilbert Clinic and I'm going to see a urologist. Okay? And I saw Dr. Jones 2 years ago about something. But Dr. Jones isn't in this week, so I see Dr. Brown, who is also a urologist at Graves Gilbert Clinic. So even though I've never seen Dr. Brown before, the fact that I saw Dr. Jones 2 years ago, I'm an established patient to Dr. Brown. Okay? So you have to know, even though that's not that same doctor, it's the same, it's within the practice and the same specialty. Now let me give you a different example. Let's say I have seen the urology providers, but let's say now they're going to send me to a cardiologist, and I haven't seen any cardiologist at Graves Gilbert Clinic before. Okay? So whatever cardiologist I see, I'm a new patient, because even though it's the same practice, meaning Graves Gilbert Clinic, it's a whole different specialty. Okay? So I hope that helps clear that up. So you have to know new or established. Established means within the last 3 years in the same specialty. Okay? Some things we need to know if they're initial or subsequent, a consultation, okay? And here's an example of with the difference between a referral and a consultation. They sometimes are used interchangeably, but they're not the same thing. A consult means a provider, probably a primary care provider, but not always. The provider asks a specialist to give an opinion. Okay? So they give an opinion, so the consulting doctor looks at all the records, all the test results, maybe sees the patient, examines the patient, and says, based on my review, I think the patient has this, and I recommend this course of treatment. That's a consult. Okay? If they transfer the care, meaning, let's say they've seen the specialist and they want the specialist to treat the patient, so they're transferring the care, that's a referral. Okay? So that's the difference on those things. All right. So let's get into it. So let's go to, the first thing I want you to do is stop your recording, and I want you to go to the tables that are before page 1. Okay, they're on page XXV. Okay, so if you look at these tables, so if you see the first one in the top left corner, it says office or other outpatient service, patient new. Okay, so we're going to have a history and exam, and then which you'll see there's an X in every box there, every level. So what we call levels are the 99202, the 203, 204, 205. That's a level of an E&M code. Okay, but you'll notice that the decision making is different for every level. Okay, you also can go on time. The thing about time is the provider has to document the time. You can't guess. It actually has to be in the documentation. Okay, so history means that they talk about, they do a history of the patient, which means they include the chief complaint. Chief complaint means the reason the patient is there to see the doctor in his or her own words. A history of the present illness or concern, meaning I sprained my ankle, it happened on Saturday, I was doing this, it hurts this is, I've iced it, I've, wrapped it, that kind of thing. Okay? That's what a history means. Then they're going to do, so here's different kinds of history. Okay? It could, so every history is going to take into consideration the complaint, the present illness or concern, and then they're going to do a review. A review of systems means how many of these do they address? So constitutional means things like fever, weight loss, etc. If they ask about the eyes, okay, so based on each body system, what they ask about in their history. You know, have you had any eye problems? So think about when you go for a sinus infection, or you think you have a sinus infection. They're going to ask you about what you're there for, when these symptoms started occurring, what symptoms they are you coughing up stuff? What color is it? Is your throat sore, or is your nose stuffy? Are you having any problems breathing? Are you wheezing? That kind of stuff, okay? So that's going to be things like, have you had any fever? So it's going to be this one, constitutional. They might talk about your eyes, depending on are your eyes red or itchy. They're going to ask you about your mouth and nose when they ask you about your sore throat. They're going to ask about your respiratory system. Are you having problems breathing? Okay, so right there's 3 systems that they've reviewed in your history. Okay? Might ask you, like, do you have any allergies? Those kinds of things, okay? They're also going to ask you things possibly about your past or family social history. Meaning, depending on what it is there any history of heart disease in your family? Is there any history of breast cancer in your family? Have you had any heart disease in your past? Probably when you go to the physician, they're going to give you that form to fill out. And they've got all these body systems listed, and they're going to ask you to check them. Like, do you have a family history, or do you have a personal history of any of this stuff? Okay? So that's part of your history. Okay? Then we're going to go to exam. Okay? So if you notice that the exam titles are the same as the history: problem focused, expanded problem focused, detailed, comprehensive. Okay? So same thing. So history was just asking about your history of the body system. Now the physician's actually examining them. Okay? So back to that sinus infection. Are they only how many body systems are they looking at? Are they looking at your eyes? Are they looking at your throat? Are they listening to your lungs? Are they listening to your heart? Okay, right there's 4. Okay? So here's an example of body areas and organ systems. And that's how they count how extensive the exam is. Okay? So I'm going to stop here, and then I'm going to continue the next video on decision making.